Accessing services. How to access government services. This session provides information to assist you with the process of accessing services to meet your changing needs to ensure that you have the support you need. Contact the Home and Community Care Office in your health authority to request an assessment for services, or healthcare professionals such as a doctor, nurse, pharmacist, or social worker can also make a referral on your behalf. When a request for an assessment is received by your local home and community care office, a healthcare professional will contact you to determine your eligibility for services and arrange to have a needs assessment conducted if appropriate. If a needs assessment is not required, or if you're not eligible for home and community care services, you may be referred to other appropriate resources. When we're speaking about eligibility, you must be a Canadian citizen or have permanent resident status. You must be a resident of BC for at least 3 months and be 19 years of age or older. You must also require care following a hospital discharge, or care at home rather than hospitalization, or care due to a life-limiting illness. The role of a home and community care case manager. They act as a coordinator of services. The case manager makes phone calls and a home visit to assess a person's healthcare needs and eligibility. They also work with the family caregiver to develop a care plan of appropriate services. Be aware that planning for health and personal care can be challenging. A person's health can change suddenly, throwing plans into disarray. It is important that you keep the case manager up to date, especially if the person with dementia starts to require more care. During an assessment, the case manager will determine the person's eligibility for services, their health care needs, and whether the person will be required to pay anything toward the cost of the service. Preparing for an assessment. It can feel intrusive, and the list on this slide can feel overwhelming, but it can help both sides of the assessment process if you are aware of the need for these documents and have them ready. You may not want to give this to the case manager in front of your person, but can pass them over when you walk the case manager to the door or to their car. Have the items ready for a home assessment. The interviewer may ask to see these items to complete their assessment and to determine a person's eligibility for services. These items are also listed on the Ministry of Health's website. When preparing for an assessment, make a list of questions in advance. Some possible questions could be, if my person needs help with taking their medications, what would that assistance look like? Or how often can we expect home assistance? Or how much time is spent for each home care visit? Write down tasks that the person needs assistance with, such as bathing, dressing, toileting, eating, or meal preparation. When thinking about what assistance your person needs, think of it this way. If you were not present to assist them, would your person be able to locate food items and assemble a meal on their own? If you were not there at a meal and you've put out a meal in the fridge or left it on the counter, would your person remember to actually eat that meal? How long does it take them to dress without any prompting? Would they be able to choose appropriate clothing for the weather? It is important to think about each task as several small steps And would they be able to accomplish those steps without your assistance? The interviewer at an assessment uses a standard assessment tool. Some examples of what they are looking at are cognitive functioning, such as memory problems, day-to-day decisions like choosing when to wake up, when to eat, what to wear. They're looking at social functioning, change in participation in their preferred activities, isolation from others. They look at physical functioning, the level of difficulty in meal preparation, housework, managing medications, using the phone, dressing, toilet use, climbing the stairs, etc. They also look at home safety. They may assess the things that make the home environment hazardous, such as flooring and carpeting, lack of railings, inadequate light, heavy street traffic, etc. Some questions may be asked subtly and indirectly. For example, the interviewer may ask the person with dementia to make them a cup of tea or get them a glass of water to assess their functional abilities. Often, the caregiver leaps to be a good host. Please be aware that if the interview asks the person living with dementia for anything, try to bite your tongue, sit on your hands, and let the person try to answer or do what has been asked. Check eligibility with the Veterans Independence Program to determine whether you are eligible. The contact information is listed on this slide. If you would like to contact us with any questions about anything you've learned through this recording or other recordings, you can contact us on the First Link Dementia Helpline, Monday to Friday. In English, it is available from 9 a.m. to 8 p.m. And in Cantonese and Mandarin and Punjabi, it is available from 9 a.m. to 4 p.m. The contact numbers are listed on this slide.